Hi, I'm Dr. Arshnoor from Dr.Arshnoor's OET Institute. Thanks for loving my videos. In today's video, I'm going to explain about clinical communication criteria in OET Speaking. Before that, subscribe our channel if you haven't done till now for the latest update on it. Now, let's start the video. How will you be assessed for clinical communication? We have to look at 5 aspects for that. These are relationship building, understanding patient's perspective, providing structure, information gathering, and information giving. Now let's see all in detail. First we'll start with the relationship building. It is actually to develop a good and comfortable relation with the patient by introducing yourself decently, listening attentively and carefully, showing your concern by making him comfortable, hence showing that you care for him. And he is important for you. It may be he or she. You can use it according to the gender or the interlocutor who is. It is actually important to play the role. So if it is a male, despite of seeing the interlocutor in the female, you have to ask the questions or deal the patient as it is in the role play. Now next is avoiding judgment. That means patient should not feel that he is being judged. Otherwise, he may get agitated. Let's look at the first aspect first. That is introducing yourself. According to the role play setting, you have to explain yourself. For example, hello, I'm Dr. Jani, working in this suburban clinic or hospital, or I'm nurse. By telling your name, so you are attending nurse today or working in this hospital. Or sometimes you may say that one of the registered nurses, it should be plural, one of the registered nurses working in this hospital. While introducing yourself and starting your conversation with the patient, you have to be very polite, humble and respectful. Empathy, showing empathy is very important part in OET speaking. You can say, I can understand how difficult it is for you. I can feel your pain. So by these sentences, you can show empathy to the patient. Second aspect is understanding and incorporating the patient's perspective. Here, you have to listen to the patient's concern. For example, why is worrying? What is making or her upset? So this is very important to be understood by you. Here you have to be very careful that responses deal with the patient's ideas, his concerns and fulfilling his expectations. I'm giving some examples. You may ask, how may I help you? What brings you here today? Or what is bothering you at the moment? The secret of successful role play is to make the patient comfortable so that he or she should clearly and openly explain the problem. You have to observe his or her verbal and non-verbal expressions, and you may say or ask him, I can feel you are upset. I can sense you are nervous. So then you may say, may I know what's the reason? What is bothering you at the moment? Then you have to assure him by your sentences like, I can assure you that you are in the safe hands and the best treatment is being provided to you, so that the patient should get relaxed. Next aspect is to advise the patient by relating his own words. For example, by a conversation, I came to know, or you mentioned you're scared of the operation, or you're not satisfied by your delayed healing. Am I right? Third is providing structure. This criteria is the connecting link that is organizing the role play logically. You have to use clear signposting phrases Here, linking phrases play a significant role in explaining the concern. It is imperative to follow a logical sequence in the role play. That is, first, explaining the medical condition, second, explaining the procedure to the patient, and then third is to advise on the medication. This means, so first of all, you have to tell the patient what actually the patient is suffering from. Then, if the patient is undergoing any procedure or the treatment is given to him, you have to explain that properly. And the third is what type of medication patient has to take. When you need to change the topic, that is from gathering information to advice, you have to use a language to signpost a change in the topic. For example, we have talked about the causes of angina. Now, I am explaining about the preventive measures to be taken to avoid such conditions again. Using linking phrases in explanations make the role play impressive. So my advice is to use appropriate linking phrases. Now, fourth criteria, that is information gathering. This criteria is about asking the relevant information from the patient by asking right questions. I'm giving some relevant information regarding that. You have to be active listener. First, start with open questions, then ask closed questions. Avoid leading and compound questions. To clarify patient's meaning, there is a need to repeat the information and ask questions. You have to be an active listener and keep an eye contact while patient explains his complaints. Fifth and the last one is information giving. Here, first you have to check the patient information. I mean to say that what actually he or she knows already about his problem and what you are going to tell him. While giving information, you have to have an active two-way conversation. It means that it should not be a monologue. Don't deliver a lecture to the patient. Involve the patient actively with you. For example, chunking and checking information to allow the patient to respond. Keep on observing whether the patient has understood you properly or not. You should give him or her time to ask you any questions or clarifications. By following all these steps, hope you will be able to have a good ability to play your role play in the exam. Happy learning! Wish you all the best for your exam. Stay connected. Don't forget to like and share my videos. Subscribe our channel to get the latest updates on our channel. Thanks for watching.